Diseases affecting the brain can have wide-ranging effects on a person's health and quality of life. Here is further information about some common brain diseases. 1. Stroke occurs when blood flow to the brain is disrupted, either due to a blocked or burst blood vessel. This can lead to significant brain damage and requires immediate intervention. 2. Brain tumor. This is an abnormal mass that grows in the brain. Brain tumors can be malignant, cancerous, or benign, but both can cause serious symptoms depending on their location and size. 3. Alzheimer's disease, a chronic degenerative form of dementia that typically occurs in older age. Symptoms include a decline in cognitive function, memory loss, and behavioral changes. 4. Parkinson's disease. This disease affects the central nervous system and causes tremors, muscle rigidity, bradykinesia, and balance problems. 5. Epilepsy, a neurological disorder characterized by recurrent seizures. Seizures can be caused by electrical disturbances in the brain and require proper medical management. 6. Multiple sclerosis, MS, an autoimmune disease where the immune system attacks the myelin sheath that protects nerves in the brain and spinal cord. This can cause various symptoms depending on the location and severity of the disease. 7. Meningitis, inflammation of the membranes covering the brain and spinal cord, which can be caused by viral, bacterial, or fungal infections. This condition requires immediate medical attention. 8. Encephalitis, inflammation of the brain that can be caused by viral, bacterial, or other causes. Encephalitis can lead to serious symptoms including seizures, confusion, and other neurological issues. 9. Brain trauma, closed or open head injuries can cause brain damage that can be temporary or permanent. 10. Other brain degenerative conditions. There are various other types of degenerative brain conditions such as Huntington's disease, Wilson's disease, and others that can affect brain health and require medical attention. It's important to note that treatment for each brain disease varies depending on the individual's specific condition. Consulting with a neurology specialist will help in diagnosis and planning the appropriate treatment plan. Brain health is a crucial aspect of overall well-being, as the brain serves as the control center for the body's functions and behaviors. When the brain is affected by various diseases, it can have profound implications on a person's cognitive abilities, physical movements, emotions, and overall quality of life. In addition to the common brain diseases mentioned earlier, there are several other neurological conditions that can impact brain function and health. Cerebral palsy, a group of disorders that affect movement and muscle coordination due to damage or abnormalities in the brain that occur before, during, or shortly after birth. Huntington's disease, a genetic disorder that causes progressive breakdown of nerve cells in the brain, leading to physical and cognitive decline over time. Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease. This progressive neurodegenerative disease affects nerve cells in the brain and spinal cord, leading to muscle weakness and eventually paralysis. Cerebral vascular malformations, an abnormal formation of blood vessels in the brain that can cause seizures, headaches, and neurological deficits. Hydrocephalus, a condition characterized by the buildup of cerebrospinal fluid in the brain, which can lead to increased pressure and swelling, potentially causing brain damage. Creutzfeldt-Jakob disease, CJD, a rare degenerative brain disorder that leads to rapid mental deterioration, muscle stiffness, and other neurological symptoms. Neurodegenerative diseases, conditions like frontotemporal dementia, Pick's disease, and others that involve the progressive degeneration of nerve cells in the brain, leading to cognitive decline and impairments. Traumatic brain injury, TBI, an injury to the brain caused by an external force, such as a blow to the head, which can result in a range of cognitive, physical, and emotional symptoms. Migraines, a neurological condition characterized by recurrent moderate to severe headaches, often accompanied by nausea, vomiting, and sensitivity to light and sound. Brain aneurysm, a bulge or ballooning in a blood vessel in the brain that can rupture and cause a stroke or other serious complications. Maintaining brain health through good nutrition, regular exercise, mental stimulation, and proper medical care is essential in reducing the risk of developing brain diseases and managing their impact on overall well-being. Regular checkups with healthcare providers and early intervention can play a significant role in preserving brain function and quality of life.